Hi, everyone. Thank you for joining us today. My name is Tori, and I am a librarian at the Irvin L. Young Memorial Library in Whitewater, Wisconsin. Today, we will be hearing from Elizabeth Freeman from Epilepsy Families, Southeast Wisconsin. She will be discussing epilepsy awareness and seizure first aid. So welcome, Elizabeth. Thank you for taking time to talk to us today.
Thank you, Tori. Hi, everyone. Good afternoon. My name is Elizabeth Freeman, and I am the Marketing Communication Education Specialist at Epilepsy Families, Southeast Wisconsin. I want to thank all of you for attending the presentation. My organization, Epilepsy Families, Southeast Wisconsin, is an independent nonprofit charity that was founded in 1954. And since that time, we have been out in our communities working to support and empower individuals and families affected by epilepsy. We offer help and hope by advocating, educating, and providing epilepsy-related programs and services. I do want to mention off the bat that I am not a medical professional. So the information that I'm sharing today is for educational purposes only. Additionally, I'll be happy to answer any questions you have, but I would appreciate it if you could hold on to them until the end of the presentation. Okay. What is epilepsy? Before I get into that, I would like to ask the audience a question. I usually do this when I am giving an on-site presentation, but what I'd like to do is ask people to raise their hands if they know 26 people who live here in the United States. Now, obviously, since this is a virtual presentation, I can't see your hands, but I would venture to say that between family members, relatives, friends, coworkers, teachers, and others, we all probably know at least 26 people here in the United States. I'm losing my voice, everybody, too, so bear with me. The reason I ask this question is because 1 in every 26 people living here in the United States will be diagnosed with epilepsy at some point in their lifetime. And when I first heard this statistic, I was truly stunned. I kept thinking, that can't be right. If epilepsy is so prevalent, why don't I see or hear anything about the condition? And why do I know so little about it? And that's one of the primary reasons why Epilepsy Families exists. One of our most important goals is to increase the public's awareness of epilepsy. So what is epilepsy? Epilepsy is a very common chronic neurological disorder that's characterized by unprovoked seizures. A neurological disorder affects the brain as well as the nerves we have all over our body. Some well-known neurological disorders are migraines, Alzheimer's, and strokes. Epilepsy is actually the 4th most common neurological disorder here in the United States. Okay, so epilepsy is a neurological disorder that is characterized by unprovoked seizures. A seizure. I think the easiest way for me to explain a seizure is to say it's like an explosion of excess energy in the brain. And when this burst of excess electrical energy occurs, it causes a temporary disruption in the normal functioning of our brains. Now, believe it or not, it's not uncommon for many people to experience one seizure during their lifetime. We could have a temporary disruption in our normal brain functioning due to an extremely high fever, for example, or if someone drank an extraordinarily large quantity of alcohol and their body is trying to detoxify itself. Because of this fact, it's very difficult for doctors to diagnose someone with epilepsy until that person has actually had at least 2 seizures that have no apparent reason for having them. What is epilepsy? Again, currently there are 3 million people in the United States that live with the seizures. 60,000 of them live right here in Wisconsin, and 10,000 of that 60 are children. Another statistics I was really surprised to learn is that The 3 million people with epilepsy, actually the 3 million is twice the number of people who are living with cerebral palsy, cystic fibrosis, muscular dystrophy, and multiple sclerosis combined. So as you can see, epilepsy is not rare. Most people don't know that there are many different kinds of seizures, and they each have their own characteristics. So for this presentation, I'm going to mention just a few of them. If I were to ask every person, both inside and outside this library, to explain what a seizure is to me, most, if not all of you, would describe the seizure I think everyone, including me, sees in their minds. The seizure when someone is on the ground flopping around rather violently. This is what we call a grand mal seizure, and they're characterized by rhythmical jerking movements and brief unconsciousness. Grand mals usually last anywhere from 1 to 3 minutes. Another kind of seizure is called an absence seizure. Absence seizures occur most often in children between the ages of 4 and 14, but they can affect people at any age. A person having an absence seizure is completely unaware of their surroundings. And you will usually see the person starting to stare blankly. It's almost as if they kind of check out for a few minutes. You might also see some fluttering of the eyelids. Sometimes you'll see other slight muscle movements, such as a smacking of the lips or chewing motions. Absence seizures are extremely brief. They last approximately 10 seconds, and children often have multiple seizures in a row. Now, because of their brevity and their characteristics, parents and teachers can miss them completely, or they can be misconstrued as daydreaming and not paying attention. Before moving any further, I need to stress that epilepsy is not a contagious disorder. I know that might sound odd, but currently we don't hear much about it, and the general public doesn't know that much about it. So think about what it must have been like a long time ago. People were afraid when they saw someone jerking around on the floor without reason. They still are today. In any case, that fear caused some myths to develop about the disorder. So please share with everyone you know that epilepsy is not a contagious disorder, and especially with your kids. Causes of epilepsy. Okay, so at this point, we know that epilepsy is a common neurological disorder that's characterized by unprovoked seizures or electrical fireworks in the brain. But what exactly causes it? One of the greatest challenges for people with epilepsy and for the people treating them, the doctors and the medical professionals, is knowing what exactly caused their epilepsy. Unfortunately, 60% of the people diagnosed with this condition have no idea what really started it or what brought it about. Excuse me. When we look at epilepsy from an age perspective, we do have some understanding of its causes. When an infant or child has epilepsy, it's usually the result of some type of early life brain injury, like faulty wiring when the child is developing in the womb, for example, or an infection that a baby might get. In young adults, epilepsy is often the result of a head injury, perhaps from sports of some kind, or some type of trauma to the brain. And the most common causes of epilepsy in adults and seniors are usually other neurological disorders, such as the strokes and Alzheimer's disease. Anyone who has epilepsy, anyone can develop epilepsy at any time in their lives. In the United States, 150,000 new cases are diagnosed each year. 50 million people all over the world have epilepsy, and epilepsy does not discriminate. People of all ages, races, ethnic backgrounds, religions, social classes, genders, etc., all have epilepsy. If there are so many cases being diagnosed, excuse me, each year, millions of people are living with this condition, and we never really hear much about it. It must be curable, right? We would definitely hear more about it otherwise, right? Unfortunately, the answer is no. Research is ongoing, but currently there is no known cure for epilepsy. It's very challenging also for 33% of the people who've been diagnosed because none of the treatments that are presently available help them with their seizures. The good news is with the proper medical treatment, the other 2/3 of the people who have epilepsy are able to control their seizures. There are 4 approaches doctors will usually try to control a person's seizures. Generally, the first thing the doctor tries is medication. Unfortunately, there are side effects that people can't tolerate, so that can make medication difficult at times. There is also something some people struggle with, and that is called drug-resistant epilepsy. So the doctors then need to find an alternative treatment. Dietary therapies are used because fats, carbohydrates, and proteins directly affect the nerve chemicals in your brain. And as you all now know, epilepsy is a neurological disorder that affects the brain and the nerves in our brains. Interestingly, research has shown that seizures occur less frequently during periods of fasting for some with epilepsy. Excuse me. The keto diet, which I'm sure you've all heard of, is often recommended for people with drug-resistant epilepsy. This diet actually induces a metabolic state in the body that mimics fasting. Some of the other treatment options are a few different types of brain stimulant devices, and these can actually help reduce the number and severity of the seizures it has. Brain surgery is usually looked at as a last resort after all the other possibilities have been tried. Now, from now on, I'd like to share important seizure information, and you'll have to forgive me because a lot of this information is bulleted. So I'll be reading directly off of the slides, which I don't like to do. So the possibility is pretty high that at some point in your life, you witness someone having a seizure. And before administering first aid, there's some information that is extremely important to know and to understand. Here again, I want to reiterate that epilepsy is not contagious. So there's no need for anybody to worry about touching somebody that's having a seizure. The first thing I want to make sure everyone knows is if you see a person who is having or has had a seizure and they fall and hit their head, it's crucial that you call 911. They may have a head injury and you can't always see what's happening, obviously, in the brain. You never want to restrain a person that's having a seizure. And there's an old myth that says someone can swallow their tongue. That is physically impossible for you to do. You can actually try and swallow your tongue, and you'll find that you just can't do it. So never force anything into the mouth of somebody having a seizure. Forcing something into the mouth of a person having a seizure can result in chipping their teeth or breaking their jaw, or actually you could have an injury to yourself. Timing a seizure is crucial. If a seizure starts to near 5 minutes in length, it can be life-threatening. And at that point, you have to call 911 immediately. So if you can, as soon as you see somebody start to have a seizure, try and time that and note the time and try and know how long it's lasting. Okay, we have a graphic here. Now, there's a little bit of controversy about this. Some suggest that you try and gently roll the person on side while they're having a seizure, and some say that you should do it afterwards. The whole idea is to make sure that the person's airway is clear. You're not sure. Sometimes people vomit. You just don't know what's going to happen. So you want to make sure that they don't choke. And so that's why you turn them on their sides. Now, whether or not you do that during or after, I think largely depends on what type of seizure it is too. So just be aware of that. Some seizure first aid guidelines. This may sound illogical, but when you're in a very stressful situation, it's not logical. Try to be as calm as you can. You want to keep the person in a safe area and move them out of harm's way. Try and loosen any tight clothing they have around their neck. And then if you can, support their head with something small and soft. You want to make sure that you're with the person until their seizure is done and they start to return to a more conscious state. Once the person is alert, It's important to check for a medical ID bracelet and something called a personal seizure action plan. The seizure action is basically a piece of paper that contains specific information that's very important. It's about the person and their epilepsy, and it also has emergency contact numbers. Why should you call 911, or when, I should say? Again, if you see that someone has a head injury of some kind, you need to call 911. If there again is getting close to 5 minutes or lasts longer than that, you call 911 immediately. If the person is having repeated seizures, it's important to contact 911. If after the person has its seizure, has his or her seizure, and you notice that they're not really returning to their normal conscious alert state while seizure, you need to call 911. If the person is pregnant, injured, or ill, of course, you should call 911. Also, if the person is having difficulty breathing during and after the seizure, call 911. Obviously, if the seizure occurs in water, you'll want to call 911. And this is a difficult one. The last point is if you know it's the first time they've had a seizure. Unless you know the person personally and very well, it's a little bit difficult to know if it's a first time seizure or not. So, okay. So again, we are at the end of the presentation. And again, I want to stress that we're dedicated, our organization is dedicated to trying to optimize the quality of life for individuals and their families that are struggling with this on a daily basis. And we do that by providing direct programs and services to our community members. Our mission, again, is to support and empower people that are affected by epilepsy. And we do this by providing personal assistance, increasing public awareness, aiding our community members, and continually advocating for epilepsy. If you know someone who might benefit from our services, please have them contact us. You can visit our website for more information about epilepsy in our organization. Also, I'll be happy to answer any questions that you might think of later on. You can feel free to email me. My email address is on the title page of this presentation. I want to thank everybody so much for taking time out of your day to listen, and I hope you found the information that I presented very helpful. Have a great rest of the day.